Have you ever thought about how testosterone levels are regulated in our body naturally and also when you take external testosterone replacement therapy? Hi, I am Jay Patel and I am a certified physician assistant and I specialize in hormone replacement and testosterone replacement therapy for male and female. Today, let me explain you how testosterone is regulated in our body and how taking external testosterone affects your natural production. Testosterone is regulated by a feedback loop to maintain the balance in our body. If the testosterone level is low in our body, the first step is the secretion of gonadotropin releasing hormone by hypothalamus. Hypothalamus secretes gonadotropin releasing hormone, also known as GnRH, in response to low testosterone in the body. GnRH then signals pituitary gland to release luteinizing hormone known as LH and follicular stimulating hormone known as FSH. This LH then stimulates testes to release testosterone in the body to restore the balance. So this is what happens if the hypothalamus senses that the testosterone level in the body is low. Now if the testosterone level is high, the high level of testosterone in the body provides negative feedback to the hypothalamus and pituitary gland, reducing the release of GnRH, LH and FSH to maintain the balance. So this is how it works naturally in our body if your levels are low or high. Now when you take external testosterone, body senses that your level of testosterone is high and body sends a signal to the hypothalamus and pituitary to stop the release of GnRH, LH and FSH. This is when your natural testosterone production shuts down and may also cause some testicular atrophy because your testicles are not getting a signal for the production of testosterone because it's not getting the GnRH or LH, FSH stimulation. Now, if one of the steps in the feedback loop is not functioning properly, body's testosterone level will be low. This is when people start testosterone replacement therapy. So if your natural testosterone levels been low, then you become a candidate for testosterone replacement therapy. By taking external testosterone, you maintain the higher testosterone level in the body constantly. So this shuts down the feedback loop of testosterone by lowering the release of GnRH, LH and FSH. This is what happens when you take external testosterone and shuts down your natural production. Now, this is not the bad thing for patients not producing enough in the first place. So if you're not producing enough testosterone, it's good to start testosterone replacement therapy. But if you do still want to restore your natural production, then there are some medications like HCG, Clomid and enclomiphene which can help stimulate testes in a similar way that LH and FSH does to restart or increase your natural testosterone production in men. So this is how the feedback mechanism works. If you're not producing enough, it's good to start the testosterone replacement therapy, which will shut down your natural production. But if you still want to keep your natural production up, even while doing the testosterone replacement therapy, you can take a medication like Clomid, HCG, which is traditionally used as a fertility drug for the production or increasing the sperm count, but it also stimulates your natural testosterone production. So understand how your body works when you are taking testosterone replacement therapy. If you have more questions, comment in the comment section, and thank you for watching.